Well, thank you very much, everybody, for attending. This is the first of a series of 4 webinars that we'll be doing in the Middle East with a number of expert panels. I got to meet these gentlemen last night. We had a brief conversation about tonight's webinar. I think you're all going to really enjoy it. Very interesting, and a lot of very valuable insight as well that I got. If you didn't have a chance to read the promotional material that came your way, the original intent of these webinars was to provide, if you will, reality versus theory. I was at a conference speaking in Berlin just at the end of January, and I disagreed with what one of the presenters was saying, especially about 24/7 safety. He was sort of saying it was a waste of time. I felt like saying, do you have children? But at the end of it, I was talking with a senior vice president for a large global company, 140,000 employees all over the world. And I said, I didn't agree with him. He just looked at me and he said, well, he doesn't have to live with it, Larry. So the people that we have on these panel are the people who actually have to live with decisions. And we'll be moving from this webinar on COVID and how are they dealing, the complacency aspect, how are they dealing with it at their company in the area. But the next webinar in 3 weeks will be about leading indicators. Which ones do they believe are reliable enough to make a significant change? The one after that is going to be on, should you have zero harm in your mission statement or not? And I think we've all heard lots of academics talk on and on about this, but again, they don't have to live with it. And then the last one in this series of 4 is on felt leadership. And does that actually make it down to the employee level? So I hope you can join us for all 4 of these webinars. But when I first met Dr. Wada, it was at a conference in Prague, and his session started with a slide that had all of his credentials and bio. And I thought, oh, this is likely going to be dreary because normally people with that much background and credentials don't put a lot of effort into presenting and making it interesting for the audience. And I stayed for the whole talk. We were on an expert panel together in India at the Gas Association conference in Delhi. And then we were working on a panel again together at a conference in Kuwait. And he was kind enough to help me put this panel together for the Middle East. So I'd like you to introduce Dr. Wada. He is with Enoch. And Dr. Wada, if you could, maybe you could introduce, well, if folks, maybe if they don't know a little bit about Enoch, but I imagine most folks do, but if you could also introduce the panel for us, please.
Sure. Okay. Well, good morning, ladies and gentlemen, wherever you are, and good morning, good afternoon, good evening. It's good evening on your side, Larry, but it's good morning here in Dubai and Abu Dhabi and Bahrain, and it's probably good afternoon already in places like India. So welcome to everyone. It's a pleasure for me to be working closely with Larry and my dear colleagues here. I'll be introducing them in a minute. Just to introduce you, I work with the Emirates National Company, which is the largest oil and gas-based company in Dubai, the United Arab Emirates. It's a relatively sizable organization. We are mainly in midstream and downstream, although we have also some upstream assets. My role, I've had several roles in this organization over the last 23 plus years. I started in refining and mainly worked in HSC for about 20 of those years. Then I've also had the chance to be an executive director where I took over, looked after things like communications and legal and other areas, business excellence, etc. And currently look after sustainability, operational and business excellence. So that's me. Again, Larry's already introduced how we got to know each other, and I'd like to just introduce you to the panels. I've been involved. I've had the pleasure of being involved in a few of these panels, also with the India and the European panels. It's interesting. It's interactive. There are some structured questions which Larry's put together, and but I'm very happy to introduce actually the panelists today, because they're I consider them friends, brothers, and um, uh, mentors of mine. I don't want to say that all of them are older than me, but that's the reality. They're older than me, so I'm pleasure for me to and Abdullah always likes to say, and I tell them that, you know, if I've made it in this field or in these fields, then it's not because, you know, I stand tall, but it's because I've been allowed to stand or sit on the shoulders of these great men, people like the guys I'm going to be introducing today. So a real pleasure. I continue to work with them and interact with them. But let me just first introduce Mr. Abdullah Marzouqi. Abdullah Marzouqi is he's actually a bachelor's of engineering from the USA. He's 40 plus years of experience, rich experience, I must say. In ADNOC, he's worked mainly in upstream, but in the last 3-4 years, he also headed being the most senior director for HSE for the whole of the ADNOC group, and helped them in the transition that has taken place in the last 5 years to make one ADNOC group company. He has had extensive experience in various different areas. Also, a man who comes from operations, has worked in processing, drilling, oil storage, export projects, strategic business planning, and so on and so forth. He was a key member really of the ADNOC executive leadership team, and helped really form a lot of the policies in the, as I said, the transformed organization. He's been a member of very high-level HSE and people development steering committees. He's been involved, and I think one of the greatest things that he was heavily involved in was the development of the competency assurance management system for ADNOC over the years. He was served as the chairman of the SPE. HSE International for international conferences. Also, he chaired various other conferences, including the REXO, which is the Regional Clean Sea Organization, prior to retiring from ADNOC, and he retired only recently. Very recently, I think a couple of months ago. So he's still got the oil on his clothes from. Yeah. Then we have Mr. Ahmed Khalil Ibrahim. He's the director for HSE for the Bahrain Petroleum Company, and he's also the director for HSE for the Babco Refinery Expansion Project. He's also very much an international HSE expert. I've been around the circuit with Ahmed for the last, I don't know, Ahmed, about probably 15 years plus, going around various different conferences in different countries in the world. We've probably spoken at least 10 or 15 different places in the world. He's got about 36 plus years of process safety and fire prevention experience in oil refining. He has an MSc actually in risk management from the Aston University in the UK, and he's a member of the Bahrain Health and Safety Council, Bahrain Health and Safety Standardization Committee, and the Society of Petroleum Engineers, also SPE HSE committee as well, which he chaired when the SPE did the HSE conference in Bahrain. He internationally is also on the board on the R.W. Campbell Institute in the US, the GCC National Oil Companies EHS Committee, the SPE HSE Committee, and also chairs committees responsible for reviewing and updating the Bahrain HNS standards. If you know anybody in Bahrain and who has anything to do remotely with HSE, then they'll know Ahmed. Ahmed is an authority in the area, and he's I call him a national treasure for the GCC as well. So welcome, Ahmed, and thank you for taking the time to join us today. We know you're busy, but and I know that you're on leave today, so sorry to pull you out of your lead, but thank you very much. I've also worked closely with Ahmed on doing a lot of competency assurance or competency assessments for a lot of HSE people. So he's a man of fantastic experience. Then last but not least is Mr. Salman Abdullah. He is the Executive Vice President of the Emirates Global Aluminium and currently doing his doctorate in business administration with the Bradford School of Management, a great school which I also had the pleasure of graduating from. Salman has led health and safety, sustainability, environment quality, and also business transformation for EGA since 2016. He has a rich experience, wealth of experience really, in designing, building, operating, and maintaining large industrial plants. He joined actually Dubai Aluminium at the time, which later on became merged and became under the EGA in 1984 as an engineering apprentice. So he's a seasoned guy who's grown from the bottom of the pickle barrel, as they say. So in his about 35 years of career, he has held senior positions, including GM of Power and Desalination, Chief Operations Officer, Vice President of Operations, and Senior Vice President at the Tawila plant in Imal, which now, as I said, merged and became EGA. So Salman has also led the design, startup, and stabilization of Phase 1 and Phase 2 of Emirates Aluminium, and he works very, very closely with global institutions which are looking after safety in the aluminium industry. He has a bachelor's in electrical engineering and an MBA also from the University of Bradford. And as I said, he's pursuing his DBA at the moment. I've had the pleasure of being exposed to his work and really sort of peer reviewing it with him. And he's doing a lot of stuff on authentic leadership and social technical systems. Really very deeply philosophical work, but really very purposeful work in this region. So we're very lucky and privileged to have him with us. So last but not least, Mr. Salman Abdullah. So that's my introduction to my brothers here today, and look forward to like Larry to hearing from them, inshallah. Over to you, Larry.
Well, I know it would look kind of contrived to get you to introduce me like that. I'd love to have a great introduction like that, Wada, though. That was really well. And gentlemen, thank you so much for taking the time to
listen,
join.
Larry, listen, for the right price, I can do anything, you know?
Yeah, well, but like I said, I really enjoyed just talking with you guys last night. So, Ahmed, let me just start with you. And maybe if you could just now, I know that most of the folks listening are in the Middle East, so they're sort of aware of how things are going in terms of COVID in the area. But as we were talking about last night, you were saying sort of about two levels, and obviously the concern about complacency, over the next few months. So like I said, maybe just a brief overview about how COVID's going in your neck of the woods, and then what about the complacency and the two levels we were talking about last night?
All right, gentlemen. Good morning, good afternoon, and good evening to all that are participating at this panel and the people who are participating from outside listening to us. I hope my voice is clear. I hope you can all hear me. The COVID-19 was something that was not expected. Nobody actually expected something like this to happen. And people thought initially it was going to be over in 2 weeks, 2 months, 3 months time. Unfortunately, the situation is not yet over, and I don't know how much longer it's going to take for the situation to be over. So none of us in industry have built in their emergency pre-plan or crisis management plan something that deals with a pandemic of this size or with this this magnitude.
Mm-hmm.
So we had to learn from it, and we had to understand the implication of it in our business, but also in the community and the country at large. But in Bahrain, the situation was almost under control at many stages of the pandemic or the COVID-19. The government have established a task force led by His Royal Highness, the Crown Prince, and he actually lead this task force and meet on a regular basis. In this task force, he has ministers and some very senior people from Bahrain who are actually leading the initiative. And to be honest, if it wasn't for his leadership, the Crown Prince would be in a much worse situation. We are definitely in a much better situation like the other GCC countries. We took it very seriously. We did not, just play it by ears. We looked at science, we looked at statistics, we looked at data, we looked at other countries, and we thought this is something we shouldn't be tampering with, and we must take it as seriously as possible. And hence the establishment of this task force under the leadership of His Royal Highness, the Crown Prince. Now,
Go ahead. And then what about the people there? Are they taking it seriously? Because like I was saying last night, you'd never know in Western Canada that there was a pandemic if you were just looking at every now and again you see somebody wearing a mask, but it certainly doesn't look like anybody's going out of their way even to stay 2 meters apart. So how are the people there?
I mean, again, task force have issued certain mandates, and these mandates were compulsory. They were not for people to take decision on them. And I can tell you, if it wasn't for those mandates, we would have been in a much worse situation. Mandates such as wearing the mask, such the minimizing number of people in a gathering, such as social distancing, such as providing sanitization items in different locations. So all those mandates, limiting meetings, closing schools, closing shopping malls, travel ban, all those issues have definitely controlled the situation. And us in the Middle East, as you know, we have a lot of migrant workers, huge numbers. And if it wasn't for us closing those airports, we'd have been in a much worse situation. And I think those kind of steps that our governments in the Middle East, in particular the GCC countries, have taken, have prevented the escalation of this dangerous pandemic. We'd have had lots of fatalities, and luckily, as I said, with the wise leadership of our leaders in our countries, we have taken those steps to prevent the escalation. Now, compliance in general was at the beginning was outstanding. Everybody have complied. Then we had the month of Ramadan. Then we had the festive season, which is Eid in essence, and people unfortunately have let their guards down during those occasions, during Eid period, which is like Christmas to you in America and Europe. And unfortunately, people started not they started having social gatherings in their own homes, not in public, but their own homes, and they infected each other. So we saw at one stage, we saw an increase in the numbers of people who were infected and who became positive. But the thing that the government have done to prevent the spread of of the COVID-19, established centers all over Bahrain for quarantine purposes and for dealing with positive cases. And those quarantine facilities were fully manned by either the military or by the Ministry of Health. And those quarantine facilities again have helped us, reducing the situation to as low as possible. The other thing the government have done, they've been doing a lot of random testing. They have mobile unit that goes all over Bahrain. Bahrain, as an example, a small country, we've tested so far almost more than 1 million individuals. More than 1 million individuals were randomly tested by the government. They go all over the cities, the villages, the shopping centers, public gathering areas, and they do all those COVID-19 testing, which is not a cheap thing, but at the same time, we're trying to understand the profile of the size of the problem.
Wow.
And,
well, that actually sounds really good. So like I was just, especially compared to the effort here, right? We've done really well, but like I said, I think it's fluke. I mean, our province got recognized by the WHO, but I think it was just lucky that there wasn't a lot of virus here. It wasn't necessarily great management by the public, certainly. The company's doing a bit better. Mr. Abdul, you were also mentioning this last night about the companies and this certainly at Enoch, the standards that you folks were were employing and using the protocols. And then, that obviously there was, not nearly that level of adherence out in the public, but still didn't sound that bad. But anyhow, maybe if you could just talk a bit about what all Enoch has done, and also in the area as well, if you would.
I'll document. Anyway, yes, Assalamu alaikum. Good morning, good afternoon, good evening, good day to all of you. And Larry, and also SafeStart, thank you very much for creating this platform for us to be here and share basically some of the best practices, the things that we have managed. We do appreciate that. I will be talking about this one in basically 3 tiers. Let's look at basically at the country level what we have done, at the establishment, organizations, companies, what have you, and then we'll drill down to the individual. I think, as Dr. Wadah and our brother Ahmed said, that I think we were not ready for this one, but realizing it as a risk, I mean, that's the first step, to be convinced this is a risk, this needs to be managed, and you have to continue the business. So risk management plus the business continuity, basically they go hand to hand. We have been in UAE, let me to start with at the government level, we have been very blessed, as Ahmed said, with a wise leadership, dedicated leadership, taking this seriously at very early stage of it. We did not have to wait for somebody just coming and telling us this is going to escalate and all this. And so the government, they took this one very seriously. So the public health and public safety, that was priority number 1. So the cost, what is going to cost her, that was irrelevant. So immediately, as Ahmed really elaborated, the government, they set up makeshift hospitals. They made sure that we have enough PPEs. We made sure that we have enough ventilators, mapping each Emirates and the location, basically where are the hot zones, where are you have more populated people, where are the probability of people being infected. So they were testing people day and night, free of charge. Even we had to come going to the houses. I did myself with my family. I pick up the phone, I called them, and the next day I called them at night. The next morning they were in the house. They tested my family and the people that they work with me at home, and within less than 24 hours I had the results. So this was very, very good initiative from the government. Then disinfecting the streets, schools, is applying the hospital, basically cleaning processes, and also, as Ahmed said, in the shopping mall.
Did you just get tested? Did you just ask to get tested and they came and tested you and your family? It was that easy?
Yes, it was that easy. What they have done, they had created a priority list. People that above 60, people that they are in special needs, people that they were at high risk, those are the first batch of people that they had to go and do testing. And then they had opened to everybody. Yes, just one telephone call, and they are at home and they testing you and they send you your results on your mobile phone. So
wow.
there is
because my it's a bit odd, but my wife's maiden name is Wilson, and I have a brother-in-law named Larry. So I have a brother-in-law, Larry Wilson. Anyhow, he works construction, and he and 5 guys that he worked with, they were like sure that they got COVID because they'd never been sick like this, that long, that violent. They went to the clinic and they said, you're not bad enough, just go home. And if you get worse and you can't breathe, go to the emergency room. So he never like he went to get tested, sure that he had it, and they just told him to go home. So fair bit of contrast from what you were just saying there.
Yeah. And also this had to basically support it with a huge campaign that this is, if you are positive, you're not going to lose your job. You're not going to be punished. So if you are infected, then please come out and we have the facilities. I received an email from an individual who basically lives in this country. He was living for a short time, so he turned out to be positive, and they put him in 5-star hotel. Just that was the quarantine period for him to recuperate. So
Wow.
he was so overwhelmed that he made a video of himself and explaining how he was treated. So this kind of campaigns, it brings more people not to shy away, but basically come out, and if they feel that they are not feeling good, so they don't impact the public.
And not hide it, not make it worse. Exactly. Very good.
Absolutely.
What about the second level there, Abdullah? You were saying with at the organizational level.
Yeah, at the organization level, again, we have basically mirror image the directive that what we had from the government, and lots of organizations, for example, like ADNOC being one of the economic backbone of UAE, we are very proactive in terms of health, safety, and environment in any part of our business. So they took this one also very seriously. They had various committees, health committee, and come up with the procedures. I think around 19 different standard operating procedure that they have come up from non-essential traveling, how you behave at the work site, identifying the essential position that people they have to be there, their critical position that people they have to be there, change the work cycle so they minimize the impact on the individual. Contractor camps, which Salman will be talking about. Again, that is one of our highest risks, because our population, almost 70% of it is the contractors that they do work for us. So we had to manage those ones also very, very effectively. And as I say, it was a leadership at ADNOC level, and they took this one very seriously, and they say the health of our employees and the contractors alike is a top priority. So therefore we want to make sure that we manage this risk appropriately. And thanks God, they have done a great job, both in terms of the business continuity and managing the risk of this pandemic.
Okay, excellent. Well, let me. I'll talk to you guys all day, but Mr. Salman, I know you mentioned about 1,000 contractors. I know that Ahmed and Abdullah have many thousand. You've got what you were saying, 20,000, 22,000 Ahmed coming on this new project or something. But how are you managing? Well, how are you managing, I guess, at your workplace? That's 7,000 people, permanent folks. And then maybe just introduce the contractor and what you're doing with the contractors, and then I can go to Ahmed and Mr. Abdul as well, and Dr. Wada, and find out sort of what how they're actually managing it in terms of boots on the ground. It must be very challenging.
Yeah, sure. Thank you, Larry. This is a very important question for all the organizations in the Middle East, because when we talk about contractors, like in EGA, I am sure it is exactly the same in any other large organization. There's a different type of contractors. First is the directly supervised contractors. This is by design part of your structure. This is 24/7 working with you. The second level is service contractors who come and service, let's say, your telecommunication, your turbines, your rectifiers. And the third tier of contractors are the greenfield contractors. So the first priority was given that all the contractors are taken care of, and in particular, the ones who are very closely working with you. So we accommodate and we provide accommodation for all the 7,000 direct employees, but contractors is outsourced, so it's down to them. However, during the COVID-19, we got all the contractors in-house. So the first thing is to isolate them from any external things which were happening. So we immediately started providing them with accommodation. Second thing is, before you bring them in, we went through a double test protocol. As Abdullah has explained very, very comprehensively, that in UAE, the PCR testing was made available. So we have now an in-house facility in EGA to test all our people once every month, and it's mandatory. So everyone gets tested every month, but in particular, the contractors were double tested once we brought them in from their camps into a transit lounge, and then we tested them again, and then we housed them in our accommodation. Irrespective of where we were at the beginning, the latest results across the organization, because of this very dedicated focus and testing without questioning, without any threat of job loss or anything, we are in fraction of a percentage.
Wow, well
fact,
done.
It's less than 0.5% across the organization. And Larry, yes, you can say I understand the issues, but without leadership, without the leadership understanding that this is not a financial issue, it's something we all have to deal with for a certain time, maybe 6 months, maybe 1 year, till vaccines and treatments are available. But during this time, we have to protect people, irrespective they work for you, they don't work for you. And that's why what Abdullah was saying, even if you are working here, even if you are a visitor here, if you are found with a C19 virus, you would be taken care of. So humanity comes first, and with that mindset, all the actions were taken from top of the leadership all the way down to the shop floor to take care of the people first. So that's how we have addressed the issue of the contractors.
That's a really interesting point, Salman, because I think, especially with something like this, that trust is such a key factor. And people like making, like, one person can make it a lot worse by just not going to get tested, or making the testing difficult, or like what happened to my brother-in-law. You go to get tested and you get told, go home, and as long as you're not dying, quit whining. And who knows how many more people he could have gotten. Well, he did go home and he did do what he was supposed to do, but a lot of people might have taken a different approach, and because back then it wasn't lockdown. This was prior to that, right? So that's how all of this started, was a lot of complacency in North America, right? Like, this won't happen to us. It'll be something that stays over in Asia, that complacency bit everybody here hard. And even still, like, I still think, from what I'm hearing from you folks, you're still doing a better job managing it, both on the job and within the public, right? Like I was saying to you last night, like we all do this on the highway. We willingly stay far enough apart from the other cars. It's not the police, it's us that makes it all work. Anyhow, Dr. Wada, what about it at Enoch? They've already given us an awful lot of sort of stuff about COVID. I don't know if you wanted to just talk a bit about what the leadership group and Enoch was doing in terms of communication through all of this, or anything extra or in addition there before I ask the other gentleman?
Well, no, I wanted to do two things, just quickly comment on what they said, but before that, I mean, just to answer your question, at Enoch we've had, and since 2006, we had established at the time an occupational health function, a fully integrated occupational health services center. So the occupational health services center, the chief medical officer was sort of advising directly the CEO. In fact, during the time of COVID, so by February, what basically happened is temporarily the chief medical officer was practically reporting directly into the CEO. No, there was no change in structure. It was just, in high reliability organizations, is what happens, that during times of crisis, to be resilient, what you do is you change the structure and you leverage on the capable people within an organization in order to make fast decision making, and to make those decisions, because they are time critical, as the gentlemen were explaining. It was time critical for the leadership in the UAE, in Bahrain, to take decisions and to make decisions quickly, and not sit and think about, well, let's do a cost benefit analysis of this, and let's see how many people are going to die before we do something about it. But the reason why is because you have quite a strong leadership, you have a benevolent leadership, and you have a great deal of trust, between the people and the government and the government authorities. Whereas maybe the trust isn't there as much in some other countries because of whatever reasons. But anyway, we're not going to get into that. But
Yeah.
I think in Enoch, yeah. Sorry, go on.
No. I promised I wouldn't get into that. So.
Okay. Yes. So,
it's difficult when you're Canadian, Wada. It's difficult when you're Canadian,
Right. But anyway, what Enoch did is we our biggest risk, just like Salman explained, we house about 5,000 to 6,000 plus of our employees in various in 5, I think, locations. And so the chief medical officer, along with the guys in, for example, our retail business, went in and they devised the whole process of isolation, of testing, before even the PCR test was very, because back in early Feb and March, the PCR test wasn't as you can have access to all of it. So we started doing blood tests and looking at antibodies and stuff like that for the time being. So when we came back to these offices, so when I came back to the office, which is about, now it feels like about 2.5 months since we've been back, we've had social distancing. We wear masks around when we walk around the office. In meetings, we limit the number of people in the meeting room, etc., and all these things. So we take good precautions with that. There's a lot of education. There's a lot of online training. There's a lot of surveys. There's a lot of support from the employee assistance program for those people who are facing a little bit of stress because they're worried that they're going to get ill, etc., etc. So the company has done a lot of things and has done things very proactively, and like my brothers have said already, they I think the response was quick. It was wise, and it took. They realized very, very quickly that the situation can get out of hand. The earlier you deal with it, the better. So so in the Middle East, I think in general we've been able to handle the situation pretty well, alhamdulillah. Yeah. So.
Well, and was there something also too, Dr. Wada, you want like comments from the other folks, or did you already add on to those? Because
no, I mean, all I want, what I want to really stress on here, I think with the COVID situation in the past and today, is the fact that leadership being responsible, being authentic, being humanistic, really, and creating that level of trust, because the maturity within any organization, at an organization level or even at a country level, and at individual level, even at a family unit level, is trust. And that trust, Larry, if it's any proof, is that trust doesn't just come overnight, right? Trust is something And that's why the leadership of our organizations, the leadership of our countries, they're people who have continued to provide provide that, and that's why there's that level of trust. So it's so important when you're dealing with response to things like COVID-19 epidemics or any kind of incident of this size and this complexity, that you work together very, very collaboratively. I think collaboration is probably the key to success. Inshallah, we're going to see a bit more of that around the world as well.
Yeah. Well, it certainly sounds too like it's leading into our fourth webinar, gentlemen, the felt leadership. It seems also like you can feel it, right? You can that it's caring, that it's sincere, that the money wasn't the issue, and that got rid of a lot of barriers. And it sounds like it also got a lot more cooperation from the people. We
Well,
did
I wanted
one really interesting question.
Larry?
Go ahead. Yeah, go ahead.
So I wanted to ask actually Ahmed this question. Khalil, in terms of currently the situation with regards to complacency, have the people gotten used to it, or have people now, they got used to it, they don't care anymore, or they got used to it that they got used to comply? How would you say generally with the general public?
Study around it, people got used to complying now, and of course a huge percentage of people. There are still pockets where compliance is not that big, but I would probably, if you are asking what percentage are we at compliance, I would say probably between 80 and 90, not necessarily 100%, but I would probably say, to be on the careful side, maybe 80%, 90%.
Wow.
But it is people have to take this responsibly. It's a better responsibility. There is no sense in not complying, because you could infect your brothers or sisters, your family members. And that's what happened in one of the houses we had in Bahrain. One member of the family had infected around 30 to 40 people because he chose not to go to the. And these are the kind of messages that we are communicating to people. Look, this is if you don't do this, you could hugely affect your mother or your brother or your own kids. And I think that's extremely important. So yes, compliance seems to be at a good level at the moment. We even though we had the second Eid, but during the Eid we haven't had the same number of cases that we had in the first Eid al-Fitr. So it seemed to be. People seem to understand. So there's constant awareness and communication and lesson learned, and we're communicating those lessons learned to the communities and within our companies as well.
Yeah. Sorry. Also, I wanted to ask Salman maybe a quick question with regards to you operate obviously two major sites. One of them is in Jebel Ali in Dubai, and the other one is in Tawila in Abu Dhabi. And given that there is a checkpoint between Dubai and Abu Dhabi for the movement of staff, the movement of everyone between Dubai and Abu Dhabi and the other Emirates, the Northern Emirates, how disruptive would you say it was, or have you had to implement some change in operating processes and procedures to make it easier for people to move around from both the assets?
Yeah, so that's a very interesting question, and it was quite challenging, and it continues to be challenging. So we, in addition to the contractors, which the question I addressed earlier, all our core operations people are staying now close to the operation sites. So the Dubai team has to stay in Dubai, and the Tawila team or the Abu Dhabi team has to stay in Abu Dhabi close to the plant. And this is something which we are not going to reverse. This is a permanent change. I just cannot stress enough how expensive this whole exercise has been. But this is an important step which we have taken for the protection. And when, Dr. Wada, we talk about protection, we don't only talk about protection of the people, protection of the plant, and protection of the planet. These are the three core values, and to constantly people commuting from Northern Emirates, it's just not workable. In addition to that, we are introducing work from home policy as a permanent structural change. So people should not have to commute. Don't forget, one of the things, because we appointed an epidemiologist to specifically look at our data set, and one of the drivers which was pushing, and it is everywhere on the planet, is commute. So if you're riding on a train, a metro, or a bus, you are in a confined space for a very long period of time. So we want to eliminate commute by, first of all, bringing the operators close to the plant, and also making available for people work from home policies. Before COVID-19, this was quite unthinkable, but this is now the new reality. This is the new norm, which we all are going to get used to, and we are getting there. So I hope it addresses the question you asked.
No, it's fantastic, and I think you raised a very important point about the planet. And perhaps in the next webinar, Larry, we can talk about the impact on the changing policies in on sort of providing better sustainability and environmental protection for the for the earth. Abdullah, something similar done in ADNOC with regards to the guys in the field? Did you change the, for example, working patterns?
Yes, as I was saying earlier, in ADNOC, what was established, basically identifying the super essential individuals that they had to be in the operating sites. Those are the ones that they push the buttons, they open the valve, they run the processes and what have you. Then essential people as well, which are the second layers, and what it was established in terms of the frequency of testing them, the work cycle that was changed to make sure that the exposures are limited. Non-essential work, as Salman said, that people they did not need to be in the office or in the field. Basically, they were working from home. So it was managing the health of individual and continuing business basically in a safest manner that was possible. Sometimes a lot of unnecessary projects or maintenance that could be delayed, could be phased to later stage as well. So during the pandemic, that the non-essential basically activities, those are the ones that they need to be rescheduled. Yeah, basically, as I say, the whole industry, they followed the same norm and the same practices. And we were sharing the best practices even between the field, between the assets. Some places they were doing a little bit better, and those best practices was shared among the others as well. Also, as I say, intensifying the inspections, the auditing, to make sure that people are convinced, to make sure people that they take it seriously, because as humans we have very short memory. Once we get used to something, then we forget. So reminder, and as Ahmed Khalil was saying, one member of the family could impact everybody. Today, you have the guy who is managing the field, who is managing the refinery or managing petrochemicals. He knows if he does not show quality leadership, he's going to be affected. Whereby in safety, sometimes we say, well, the guys at the sharp end will get hurt. But this this pandemic does not discriminate and does not basically pick and choose.
That's a very interesting point, Mr. Abdullah, because like we were talking about yesterday, in Europe, safety 24/7 is, I don't want to say it's the last frontier, but they've been very reluctant. Man's home is his castle. But you can't have that sort of position with something like COVID, because it is 24/7, and so you need to be concerned with what the people are doing off the job, which means how they are actually thinking. So if I was gonna offer up one last question to you folks. It would be anything specific you're doing to help your workers or the contract employees that you're working with, to help their families, or certainly, like you said, you've at least sounds like you've at least made them comfortable to not worry about their families, to report and stuff like that was probably the biggest step. But is there anything else you've done to sort of help them in with the families in the 24/7 thing?
Yeah, I mean,
Okay, let
I
me.
can address that. One of the thing is work from home has, as we are returning to work, moving away from work from home, anybody with, of course, with as an employee with a pre-existing condition, we are still asking them to stay home, but we are also asking people who live with older parents or grandparents or people with pre-existing conditions. So we want to make sure even that this person, this employee, maybe a young person without any conditions, they can come, but we are asking them to take into account if they have people at home who could get infected if they are coming and going from work. So yes, we do take account of the family and relations of the employees to ensure that their health and their well-being is taken account as well.
Wow. Okay. Well, that's and again, a lot the big on the care, big on the sincere caring. Okay. Mr. Abdullah, what about what about ADNOC? Anything they were trying to do to help the employees at home, or the contract employees, so that one of their kids didn't get them sick and they brought it back in?
Yeah, as I say, we have a we have a, as a country, we have a huge campaign and all the facility that is provided, educating people about this pandemic, the way we manage the shopping malls, the way we manage the different activities, gymnasium, sport facilities, schools. So there is a huge effort from the government that really superseding what as individual they are doing. Now, in terms of the compliance and in terms of awareness of the family, so yes, we have the corporate communication, we have the awareness campaigns that both that individuals take the responsibility to cascade it to the families, and also we have the responsibility to give our employees the comfort that your family are safe and in a good hand. So yes, there is lots of initiative, lots of efforts. As I say, this pandemic, it impacted every individual in every corner of our planet. So is not something is localized, is not something that it belongs to one company or one country. So it requires a collective effort in terms of the awareness, in terms of being vigilant, or in terms of finding the remedies for it.
Well, no, I agree. Like it's, a man, a virus is, a man's home is his castle is no match for a deadly virus, right? That's just all there is to it, right? I sometimes, I want to quote Anthony Panepinto. He's the epidemiologist for Procter and Gamble that's on the North American panel, and he says he's in there talking to the C-level folks, and he says, I feel like Scotty from Star Trek. You can't defy the laws of biophysics, Captain. I didn't make this virus. I'm just telling you this is what's going to happen. If you do this, this is what'll happen. If you do that, I don't make the rules, right?
Yeah.
Gentlemen, there was one last question. We got to go quick. Any of you could answer. It's from the audience, and it is, I think it's fairly interesting. I just don't know how well it lends itself to a quick answer, but it is, Do you strongly believe that COVID-19 will change forever the way risk and HSE is being managed on an organizational level? Whoever sent that in, thank you very much. That was a well-worded and provocative question. Any one of you that thinks you can answer that in to Wada, go ahead, because we got about you've got to go in 2 minutes, Wada. So I'll let you answer it, because I know you'll be on time.
No, the short answer to the question is yes. But I think, Larry, the question is really a very good question, and I suggest very strongly. We have another 3 panels. We have another 3 panels planned in the next 6 weeks with Ahmed, Salman, and Abdullah, and I really think that we should bring that question up, give them some time to prepare their thinking, because it's not a question that can be answered very quickly. I mean, Salman has already mentioned things like changing policies of working from home, changing policies on commuting, looking at people, plant, and planet. Abdullah has spoken about the kind of things that they've done. Ahmed has spoken about response and things which are probably going to permanently change, because there's many expansion projects which are still going on. Bahrain's got a very big expansion project. Here we've got the Expo 2020 in Dubai. We have about 25,000 people on site. So definitely there's going to be a change. But may I strongly suggest that we park that question for the next webinar, and probably start with that question for the next webinar. I don't know what my colleagues here think.
I think that's a brilliant idea, because we want to talk about the leading indicators and zero harm and the other things, but we're in a crisis. So for all the other panels, we've always had like at least a couple minutes from everybody at the beginning of the next one, just almost like a COVID update, new ideas, things that worked. Communications from leadership that were effective. So let's start with that in 3 weeks, gentlemen. The next one on leading indicators, everybody, if you do have some colleagues that could attend, we'd really appreciate it, because the ones in both North America and in India turned out to be a little more than just interesting and informative. And we ended up with a very innocent question that nobody can answer. And that was, does anybody have an example of somebody being able to go into an executive boardroom with spreadsheets and graphs and show leading indicators heading in the wrong direction, and from that presentation got the company to make a significant change, or what we would say in the corporate world, a pivot? We all had examples of big pivots after disasters, but we didn't have any on the proactive end. So we really want to open this up and see if we all believed in the tide. Like if everything was going up, the incidents were coming down, as long as the quality was good, yes. But very, very, very interesting that none of us, we all kind of thought everybody else would. You had a great example, Watt, of stopping an unsafe, a job where the scaffolding was with rope and you had to shut it all down and get it secured properly and so on. But that wasn't what I was meaning. I was meaning more when you went in with spreadsheets and graphs. So if you can, it will be in 3 weeks, same time, everybody, and we really hope you can join us. Please feel free to forward the link on to any of your colleagues. I would really like to get to the bottom of this in the next one on leading indicators. So please join us for that. And gentlemen, thank you very much for the time and the input. And I really enjoyed talking to you, and I would all day. But Dr. Wada has a meeting, and everybody else probably has to go. So we'll see y'all in 3 weeks. Thank you all again, very, very much.
Thank you very much, guys. Thank you very much.
Thank you. Thanks everybody. Yeah, and all our audiences as well.